be having a conversation about health infrastructure. Of course, we'll be looking at the health space in its totality, but focusing primarily on COVID-19 at this stage, because the pandemic, it does remain the big elephant in the economic room. And in recent days, Germany, France, Italy, Spain and Kenya have all tightened lockdown restrictions as the number of cases continue to climb at alarming rates. But there is a light at the end of the tunnel, of course, many countries progressing in their vaccination drives, however, others lagging behind. India, being one of the hardest hit countries by the virus, has set a target, a very ambitious one, to vaccinate around 300 million people within 3 to 4 months. In Africa, the target is also to achieve a herd immunity this year, although presently just over 1% of Africans have received a jab. So this panel will look at health and how infrastructure in delivering critical healthcare services can be improved to boost economies and also their recoveries from the pandemic-induced downturn. Let me introduce you to your speakers. Before that, a quick scene setter.
The World Bank says that the COVID-19 outbreak has sparked off the Sub-Saharan region's first recession in 25 years. With high rates of HIV, malaria, diabetes, hypertension and malnourishment prevalent, a large number of Africans were already faced with a health and economic crisis. Growth is expected to plummet to between -2.1 and -5.1% in 2020 from a modest 2.4% in 2019. India has already dispatched medical assistance to 25 African countries to assist with the COVID pandemic. There is a need to strengthen and improve existing systems and structures, as well as service delivery and resources within the healthcare system. And contingencies have been made to combat the effects of COVID-19 and address shortfalls of the healthcare system in coping with the burden of ill health.
Quinton Zunga, CEO at RH Bupilo. Dr. Elikem Tamaklo, Managing Director at Nyao Medical Center in Ghana. Dr. Sangita Reddy, Joint Managing Director at Apollo Hospitals. The moderator is CNBC Africa anchor Fifi Peters.
Well, let us get straight to it, and welcome to you all. Thanks so much for joining the summit. Dr. Sangita, I'd like to begin with you because we have recently heard from the Serum Institute of India regarding the very massive, described as ambitious by some media, vaccination drive to vaccinate around 300 million people within 3 to 4 months. Can you talk to us presently about how things are going and the complexities that you may be experiencing along the way? Dr. Sangita, if you could just unmute for us.
So, hello, it's a pleasure to be here. Let me begin by saying that we believe that India has managed the overall pandemic fairly well, starting with our early lockdown and moving on to an integrated approach, which included ramping up of the health infrastructure, involving the public and private sectors very collaboratively, clear guidelines in terms of testing, tracing, and now, most importantly, of course, the treatment. So we did manage to emerge so far with a death rate which is under 1.5%, which I think is quite good compared to many of the global numbers. And now the race is on to get a significant portion of our population vaccinated so that we can achieve this herd immunity.
Exactly.
Now, currently, I must say that we have an underlying technology which has been put forward by the government, which is the COVID app, and that has been instrumental in ensuring that there is some system into this overall approach where over 5,000 different centers are currently vaccinating, and the target is to more than treble this number. Luckily, we have sufficient supply of the vaccines. Being a large manufacturer, India has 2 of the large manufacturers. And actually, now, even before the COVID, about 60% of the global vaccines are manufactured in India. So many of these facilities have been repurposed to handle the COVID pandemic. So with adequate supply, a good cooperation between public and private, an underlying IT system to ensure efficiency, and now a public communication system to overcome any vaccine hesitancy and ensure that people come in, as well as a calibrated public health approach where we began with the healthcare workers, we went on to frontline workers like police and the army, now then moved into the vulnerable patients individuals over 65 years of age and people over 45 years of age with comorbidities. From April 1st, we open up to all public over 45 years of age, and we're expecting that by May, it will be open to everyone over 20.
Right.
So with this calibrated, integrated, synchronized approach, we do believe that India can do fairly well. Of course, we have, as of now, we're close to about 5 crore people who have been vaccinated so far. And we need to enhance the number of centers and scale up even further. But everybody's working to make sure that this happens.
Quite an optimistic...
I think I'll stop for now.
Thank you, ma'am. Quite an optimistic tone that you have kicked off this discussion on. I don't know if us here on the continent have got as much positivity to share around the progress that we are making in our vaccination program. But let me bring in Dr. Ellie Kem into the discussion right now, because Ghana was one of the first countries, I believe, to receive a batch of vaccines from the COVAX facility. And you began with your vaccination program earlier this month. How are things going on your end?
Well, thank you for having me. And it's really interesting because I think Ghana has learned a lot around the need for partnership. And I'm privileged to be one of the few private organizations that have been playing a role in this. But it's been with the coordination, as Sanjita mentioned, of public and private sector. And also, obviously, the non-governmental organizations and not-for-profits in a coordination that supports the delivery of vaccines and the care of patients. So looking at the vaccine, we've always been working with our region, our districts, in terms of public health. And I think that becomes a key for any infrastructure that's already laid out. When you have an epidemic or a pandemic like COVID, it's about how quickly you can adapt and change. And so we had existing routes of vaccine delivery, which the government was able to pivot and start to implement the COVID vaccines. So for us, as we had already been working with the government, kind of transitioning to delivering COVID vaccines was easier. But I think that for any of the challenges that you will see, it's all about how well all these different parties can coordinate and communicate to look at the measured impact. So even though Ghana has had a number of vaccines, there's still a lot less than our population. And we have a plan to deliver 20 million vaccines in the country for this year. But like every other country, the global supply chain, it's how well we can work with our global partners to facilitate that.
Right. And we'll discuss the global supply chain dynamics in just a moment. But Quinton, lovely to talk with you. I believe it's the first time we are speaking this year, but we've heard from our other respective panelists about communication and coordination and collaboration. And I'm just looking and trying to understand those 3 C's, and I do believe that that is what has been lacking quite significantly in how we are getting and progressing on our vaccination drive. But you are kind of on the ground, given that you play in the pharma and the hospital space. In your view, I mean, where are we getting it wrong as South Africa?
I think communication is far more complicated than we anticipated. I am sure you have seen how social media has overtaken regulators and has overtaken the practitioners. So it's been much easier to scare or frustrate the process around vaccination and the interventions towards COVID, because we live in a rapidly evolving media platform. That said, the response to that has needed to be consistent, and it hasn't been as consistent as one would have liked, specifically because none of the governments or prescribed institution were able to say exactly what are they going to get for the vaccine and which vaccine. So everybody had a viewpoint about whether the Russian vaccine, whether the AstraZeneca with Moderna, and already it's such a complex maze of which vaccine am I going to get? Do I want that vaccine? Do I not want? Coupled with a whole lot of traditions and complexity, and it's left the government's quite overwhelmed. It's because COVID has been an evolving story where the story has been changing. You're going to get those lapses, but I would like to take credit with a lot of governments. I think they have been trying, and it sometimes boils down to also individuals and responsibility.
Yeah, no, very complex indeed. In fact, this morning I read the latest developments out of Europe. I believe that Europe may soon block any vaccines leaving that country over concerns around global supply and that region not getting enough supply from some of the manufacturers. And Dr. Sangita, just to come to you, because I mean, in India's case, perhaps the issue around the availability of supply is not that much of an issue, given that you are manufacturing a lot of or the vaccine that a lot of the world and also the continent will be receiving by way of the AstraZeneca vaccine done in conjunction with the Oxford University. So I'd just like your thoughts here as to the issue of supply chains and perhaps the areas and the lessons that we can take from a player like India in the event of another crisis or another pandemic further down the track that again finds us in this situation whereby we're all grappling over supply.
So I think at a global level, one of the biggest lessons is to ensure that you have more than one source for your supply chain. Having said that, in India, I want to reiterate that the AstraZeneca vaccine in conjunction with Oxford is being manufactured by the Serum Institute in India. They currently have a stated capacity of more than 5 million vaccines a month. In addition to that, we also have Bharat Biotech with a stated capacity of over 1 million, and both of them are ramping up capacity. In addition to that, there is the J&J vaccine, which will soon be available in India, and 3 other vaccines, which are in final stages of going for approval with the drug controller. So not only do we have potentially 5 credible sources of vaccine, so I would urge governments across the world and private providers across the world, and we'd be very happy to organize these visits so that you make your cooperation and your collaboration agreements, because it is very well known that India offers not only high quality healthcare and pharmaceuticals, but are also extremely cost effective.
Yeah.
So that is our invitation, number one. And also in the height of the pandemic, the Prime Minister of India came out with a very clear policy to say that we should support the world as much as we can. As you said very appropriately, Fifi, in your preamble, India has already shipped vaccines to over 25 countries. Mm-hmm. So there was no concept of blocking and saying that we're going to keep this only for our country. We tried to share it with the world because I think this is a global pandemic and we're in it together. We're here to support in any way possible. And if anybody is seeking a playbook, a detailed strategy in terms of how to roll out individual units, storage, cold chain, training modules, any of these if you're seeking out, I'm very sure that either at a private scale or from the government, we will be very happy to share that. And just, for those who do not know our institution, Apollo Hospitals has over 10,000 beds. We receive a large number of patients from your continent, and therefore we feel an affinity to help in any way that we can. We also have Medvarsity, which is an online learning and training institution. We have a lot of students from the African subcontinent. So any way that we can help, we're very happy to assist. So people may feel free to reach out to us.
Listen, this is a platform for learning and sharing and exchanging ideas, so I can actually see or imagine a lot of virtual hands going up there to get a hold of that playbook, Dr. Sangita. But Dr. Alikam, just to come to you, as we talk about, grappling with the issue of supply, you did allude to the fact that, Ghana would also find itself in need of a whole lot more vaccines to get its desired level of herd immunity at its desired target. So we've got, in terms of an idea put on the table, being diversifying supply chains that we can certainly use. But I just wonder the thinking around also perhaps capacitating our local industries and local manufacturing facilities to do so in the event of a future crisis akin to that of COVID-19. What's your thinking around that, and the kind of policy directives and the kind of investments perhaps that will be needed to make that happen?
I think it's actually a very topical conversation, because what COVID did was to show the reality of the lack of diversity, not just in terms of the global supply chain, but in terms of local manufacturing capacity and capability. And the reason, if you look at Africa, Africa has 52 countries. It's very diverse, very difficult to reach areas. And how do you move goods from different regions, much less even countries? And so there's a few initiatives of the Africa Free Trade Continental Agreement, which is based in Ghana, but really around simplifying the movement of goods from countries. And that supports that macroeconomic drive for developing and bolstering that local capacity. The population of Ghana is actually about 30 million. And when you look at that market as compared to West Africa, which might be several hundreds of millions, and then Africa, it makes now much more sense to look at your play in coming to Africa as a diversified multi-country strategy as compared to just one region. I think Ghana is positioned for that. The president has policies which are really labeled like Ghana Beyond Aid, where the days where Ghana or other countries were dependent on people giving grants, it's really about creating policies that bolster private sector involvement and the growth of industries in countries. So these policies, I would say that the intent and the execution, there's always a matter of timing. And where you have something like a pandemic, the speed by which we have to execute has been, we have to do so much more. And I think that's a different way of thinking around how we go about implementing. So partnerships will become key. Instead of having to create from the ground, is how do we leverage the intellectual property and the know-how from around the world, and then bring that so we can do things faster. And I think that would be how we as an organization, as a hospital, we are actually in a growth trajectory where we are growing not just across Ghana, but we're also looking in the long term to move beyond. We get patients coming from outside of Ghana into our country.
Right.
The ability to take care of these patients is very limited. So we have to manage working with the government in terms of policy and influencing the right policies.
Right, exactly, because the gaps in our healthcare system and infrastructure, they extend way beyond COVID-19. And, some may say that perhaps also this pandemic, as it's teaching us a lot along the way, it potentially is also diverting our attention from plugging in all the other gaps across our health value chain. And Quinton, to bring you in here, RH Bupelo went out and listed, I believe, in Rwanda last year. As we were all grappling with the pandemic and working from home and under lockdown, yet you still went. And I just wondered to what degree the politics around the vaccines right now that we are witnessing all over the world are perhaps standing in the way of your initial expansion or initial reason to expand, and that being to provide, affordable healthcare to Africans, and to provide healthcare that was accessible for all.
Thank you, Fifi. I think what we've seen is at the midst of the pandemic, capital formation in healthcare was a little slower. Because a lot of the institutional investors were defending existing portfolio assets. I mean, what we are a consolidation of 4 healthcare funds, about $300 million and commitments and $500 million in assets. But what we have seen a lot of part of the end of year is a increase in capital formation in Sub-Saharan African healthcare investments, and obviously because healthcare has become more topical. Now, strategically, what is lacking is consolidation opportunities. Right now, you have very few. In fact, you don't have a Pan-African healthcare platform. So you are still very much in a regional play, which makes very difficult policy decision when it comes to things like vaccination, because you are at a micro level dealing with just one country or just one city. So what is needed and what we see is a greater play going forward is creating premier Pan-African institution, not just from a development institutional IP on vaccination, but also from an infrastructure perspective. One would have hoped, as much as growth in telecoms as in cement production, in FMCG, they are Pan-African champions. It is not happening in healthcare yet. And obviously that comes into a collaboration bucket. Like, there needs to be more collaboration and seeing a much bigger picture, which is going to help in future interventions. When another pandemic comes, we will be more prepared. So hopefully that cycle is going to evolve much quicker.
Yeah, hopefully. Hopefully you might even be the Pan-African champion in healthcare that we speak about in future, Quinton. Hopefully. But Dr. Sangita, just to bring you back, I mean, you spoke about, sharing, very kindly sharing that COVID-19 playbook. But of course, the challenges in the healthcare sector, they extend beyond COVID-19. And I'm just wondering what your thoughts are on sharing best practice across the healthcare space with the continent. I mean, we haven't even spoken about the fact that the issues of HIV is still very, very big here. The issue of non-communicable diseases in the form of diabetes, which I believe we both share as India and Africa, is still very big, as is malaria. What are your thoughts on how the two regions can collaborate to plug in the gaps in those spaces?
So that's a fantastic question, but it's a very broad-based one. And I think at a high level, what we need to do is really look at what is the ultimate goal of a healthcare system or an infrastructure. It is to keep people healthy and then to be able to treat them when they're sick. And this requires the core infrastructure of clinics, hospitals, laboratories, manufacturing, supply chain, the entire system. It requires a design which integrates these in an appropriate manner with an underlying technology. And then it also requires a financial mechanism, whether it's insurance or some other methodology to enable payment. So I think Africa is at a potential time where you have the luxury of designing this new infrastructure, which can leapfrog some of the legacy systems of other countries and proactively work on a positive health, preventive focused, primary healthcare strong type infrastructure and system. And I know the primary healthcare system in some pockets of Africa is actually very good and being held up as global models. But what we need is scale, we need standardization, we need access for people. And all this requires not just the money, but also the will and the design to do it in an integrated manner. So I reiterate, I'm very sure that India would be very happy to find ways to participate and collaborate. We haven't solved all the problems in our country as well, but we also have pockets of excellence, and we're beginning to see that when appropriately applied in system and design, we match the world in terms of tertiary healthcare outcomes, but we do it at 1/10 of the prices. We realize that investment in primary healthcare brings down and can control non-communicable disease and therefore bring down the cost of advanced care. And we are absolutely at the cutting edge in terms of the use of technology to enable the system as well as to make what is being, well coined now, that the geography of distance between the doctor and the patient has become history because the doctor is available in every home on everybody's mobile phone. So considering the power of telemedicine and technology, the future of artificial intelligence, and the importance and the need for us to control non-communicable disease and work on an early detection-based innovative new system, I believe the time is now for Africa as a continent and for each individual country in this beautiful continent to focus, to invest, and to strengthen their healthcare systems. And in this journey, I reiterate, India as a country and Apollo Hospital as an organization and an institution will be very happy to share or partner in any way that we can.
Dr. Ali Khan, perhaps a view from you. I mean, we're very grateful for the acceleration of telemedicine under the past 12 months under lockdown. It really made consultation costs a lot cheaper for a lot of the citizenry, which of course has been an impediment to accessing healthcare. But just your comments on how we strengthen our healthcare infrastructure on the continent and the role that partnerships can play, partnerships from the likes of our partners in India can play in helping us solve the crisis at an accelerated pace.
No, I think there's so much, it's such a broad topic, because I think even looking at technology, partnerships, Africa has a very, in terms of our doctor-patient ratios, is extremely low comparative to the world. And when you look at subspecialty care, a lot of doctors were trained outside of our countries because that's where the technology, that's where the research and development was happening. So there's connecting the dots between bringing the skill in terms of the people. And so it's about connecting with partners like Apollo, partners in South Africa, but also connecting with all of our people who are in the diaspora, who are already doing this kind of work in a way that supports their stage of life, whereby they might have a lot of children already in schools. Even though we might not be caught up in terms of all the different interlinks, it's about using technology and bridging the gap. For us in Ghana, actually, we're still learning, because design requires empathy, and each user is different. So how people behave in India is very different from how people behave in South Africa and in Ghana. And so understanding how people interact with telemedicine, that's been very much a lesson for us, because we would have thought that virtual clinics would have been easily adopted. But then you have issues like the quality, how expensive data is, whether video calls will work versus audio calls. And so it's about having this flexible mode of learning, and then incrementally getting to a stage where you can scale.
Yeah.
So I think for us, we're excited about the future. I think COVID has highlighted the need for learning, partnership, but then also about good execution. And that any entity that's willing to do this, I think, has a great future. And obviously the beneficiary will be the people who are in the community. Because as Sanjita mentioned, it's about healthcare prevention and wellness. That's really the goal. And that's where the complexity comes in.
Yeah, no, certainly. And I think if you look at the level of collaboration, particularly as we hone into the use of telemedicine, for instance, I think it will require a lot of more partnerships with those in the telecom space. I believe that during the pandemic, we did see them rising to the occasion and zero rating things like education. And perhaps there is further room for the sector, the telecom sector, to look at zero rating aspects in health, to make healthcare a lot more accessible for the citizenry. But Quinton, just final thoughts from you. I mean, you spoke about the desire to perhaps one day become a Pan-African champion in the healthcare space. What is currently locking you down from doing so? Perhaps if you can just talk to the investment bottlenecks that's preventing you from achieving your dream in 2 minutes, please.
2 minutes. So the investment landscape of African healthcare is fairly complex. As you know, with 53 countries, all with different regulations. That's one thing. Second thing is that we need to have standardized protocols around training of medical professions and clinical professions. We don't have that. We also need to have significant capital formation. I mean, we're talking about a continent where you're going to see one hospital there, one hospital there, one hospital there. We need multi-billion dollar groups active on the continent. We do think this is definitely an opportunity frontier, but it has to be done country by country, situation by situation, which is slow. We have taken 10 years to accumulate $500 million of assets, and we're still very small. And we think we don't want to take another 10 years to accumulate the next $500 million. But this pandemic, although has initially disrupted all models, has made healthcare acute in the minds of all impact investing community. So that's a very big plus. And what is required is obviously for us to put financeable, bankable structures for the international community, the local institutional community to invest in. And that is what our firm is doing. We are very much a Pan-African vision. We think you need to have one or two big portals to talk to the whole continent in terms of developing infrastructure and being able to collate data. Right now, the channels of data collection break up on a country-by-country basis because nobody's looking at it holistic. So that's what we're trying to do.
Thank you, Quinton, for keeping your 2 minutes perfectly on time. But I agree with you 100%. I mean, a lot of focus being on the healthcare space right now, and it's an opportunity. A lot of impact funds are looking to enter the space, but in order for them to do so, what I've probably been singing the entire day, a stable political and policy framework will be necessary. But I'd like to thank each and every one of you for joining the Indo-Africa Summit for 2021, and have a great rest of the afternoon. As we head to wrapping up what has been a successful 2 days, if I do say so myself, I'd like to welcome the lady who has been steering the ship for us quite successfully so as well, the MC Zinati. Welcome.
Thank you, Fifi. Well, it has indeed been an amazing 2 days, and just, you know, the whole theme of this summit has been about partnerships, and I especially was very interested in the role that partnerships in medicine can play in boosting our healthcare system at an accelerated pace. Very interesting that we are moving to a space of telemedicine where, you know, the role of telecommunications companies and regulators will also play a role in the masses accessing those kinds of systems. But yeah, indeed, it has been a very informative and stimulating 2 days. Thank you very much, Fifi, and also for moderating 2 panels for today. On Zoom now from India is Juzar Korikiwala, Vice President of IMC Chamber of Commerce, with concluding remarks on this 2-day event.
Juzar Korikiwala, Vice President of IMC. He established Biostart India Limited in the year 2002 and is the Chairman and Managing Director. The company is headquartered in Mumbai.
Thank you. Good afternoon and good evening to all of you. I've sat through all the 7 panels over the last 2 days, and I promise you it has been the most knowledgeable sessions that I have heard or seen for quite a while. But I must say something different here. The African continent and India has given us 2 great leaders whose moral compass has indeed changed the world and influenced this political discourse. Mahatma Gandhi found his political roots in South Africa, as well as he was associated with the Indian Merchants Chamber long back, and liberated India through the moral force of non-violence. Whilst on the African continent, we had Nelson Mandela, who, being released from the island prison after 27 years, dismantled apartheid in a very non-violent manner and gave rise to what we now call a rainbow nation. India and Africa are both rainbows, steeped in the diversity of culture, language, people, and wanting to aspire to grow very rapidly. What I've heard over the last 2 days are 3 or 4 words: opportunity, potential, demographics, dividend, are sounds that we have heard amongst all the 7 panels that we heard in the last 2 days. And these were in the areas of infrastructure, health, education, energy transition, e-mobility, finance, mineral resources, and so on. When we look at the development of Southeast Asian countries, nations like Vietnam, Malaysia, Taiwan, Korea, Indonesia, we find that the overseas Chinese who are spread all over these countries have really, and who have links and roots to mainland China, have really transformed these countries into very strong economies over the period of time and created an economic miracle, as we know. So also I feel the Asians who are now spread all over Africa can create the same economic miracle with roots and links to India. This is a great opportunity, as some panelists have mentioned, that partnership is the way to go. So as I conclude and thank all the 7 panelists, I would like to make a special mention who started the whole last 2 days with Anil Agarwal ji, founder and chairman of Vedanta Enterprise Resources, Ms. Busi Mabuza, chair of the Board of Industrial Development Corporation, for sparing their time and being with us. We are also very obliged to our minister, Mr. Dharmendra Pradhan, who talked of trusted partnership and the amount of work that is being done in India on the mineral resources. And Mr. Olamilekan, Minister of Mines and Steel Development, who was represented by his very able deputy. Our grateful thanks to all the speakers in all the panels that were there. They were wonderful speakers, and we learned really a lot from them. And I would like to thank our moderators who have been exceptionally brilliant: Mr. Niraya Verma, Godfrey Mutisma, Nayan Patel, and Fifi Peters, who actually managed 3 panels in one go, and our own Mr. Dinesh Joshi, who gave a wonderful speech this early this afternoon. With this, I'd like to conclude this Indo-African summit, and it's been a wonderful experience and a knowledge-gaining exercise over the last 2 days. Thank you very much, all of you.
Thank you very much for those powerful closing remarks, Josiah. That brings us to the end of today's proceedings and to the 2-day Indo-Africa Summit. And just to echo the words of Josiah, thank you very much to all the speakers, panelists and moderators who made the discussions so vibrant and in-depth, sharing their knowledge and expertise. And thank you to you, our live audience on CNBC Africa and on the webinar, for engaging and sharing these 2 days with us. Until next time, from me, Zinati Kuma, and the production, editorial and management teams behind the scenes, this is goodbye.